Hello everyone, I'm Meteorologist Charlie Ironmonger. Thank you so much for joining me today for your 2 p.m. news and weather update from the First Alert Desk. Now we've got news out of Wayne County where a turkey breeder has been shut down due to bird flu. The good news is it's being reported that it will not have an impact on Thanksgiving. Now, the North Carolina Department of Agriculture and Consumer Services has closed the unnamed turkey breeding operation after a positive strand for the bird flu was found. According to the department, a sample from the breeder was sent to the veterinary diagnostics lab in Raleigh and was testing positive. This is the first positive case in the state since January. This case in Wayne County has impacted 9,500 turkeys, but the virus is considered a low risk to humans. It is dangerous to the birds it infects, but not a food safety threat, according to state officials. Now, state veterinarian Mike Martin said that this will not impact turkey availability for Thanksgiving. And now we again want to turn to, it does look like we actually have Governor Josh Stein, who is hosting a medical debt roundtable. We have him live. We will go to that as we speak. It does look like our reporter is getting the shot up. So here is, again, Governor Stein.
Start with Chris and go around the horn. Does that sound good?
Yeah, just do it. 1 second, Mike.
I can give like a prefatory comment. That'd be fine. Yeah, love that. True. We're just trying to get into the job.
Everybody ready?
Yes, sir.
Okay, great. I'm really proud of North Carolina's innovative medical debt relief program. Dr. Sangvi, Secretary of DHHS, is overseeing this. It's a partnership between the state and our 99 medical hospitals. They have relieved the debt of 2.5 million North Carolinians, totaling $6.5 billion. This is truly an immense relief for these families because it's an anvil. They're having to carry this weight on their back, and it causes financial challenges. Hard to get credit, hard to get a house, a car. It could stop you from getting a job. But it also has a real emotional and physical consequence as well. When people have this debt, they feel shame, they feel guilt. It keeps them from getting necessary treatments. And so to relieve $6.5 billion of medical debt for 2.5 million North Carolinians, this is something for us to be proud of.
Hey, you want to start us off?
Okay, yeah. Just for starters, could you speak a little bit to the policy itself? You're working with 99 hospitals, and I know you kind of touched on it. How does that come to fruition, and kind of what was their involvement with it?
Yeah, it was an actual outgrowth of North Carolina expanding Medicaid. When we did that, there were some negotiations about, and it's very technical, it's called the HASP payment, and I'm going to say it, and I'm going to say it wrong, and then Dev's going to correct me. But what it enabled us to do is say for hospitals, if you want to be eligible to this program, one thing we ask you to do is to relieve the debt of people and to come up with a charity care policy that makes sense going forward.
That's exactly right. The idea is that if you meet the income eligibility, then your debt would be relieved. If you're in the Medicaid program, it went back as far as 10 years. For others who were not in Medicaid, it depended on where you ranked with respect to your eligibility based on income, or if the amount of debt that you had was in excess of 5% of what you earned, you also qualified, and that look-back period was about 2 years. So this is a fairly significant amount of look-back period to erase that debt.
And what do you think it means for North Carolina to be kind of one of the first states to make this program happen?
There's so much innovation in this state, and this is an area where the government and our hospitals came together and solved a problem that's real. This debt is a real burden on North Carolinians. And 2.5 million, that's just about 20-25% of the state, now have had that debt relieved, which means that they can not worry about having to go to the doctor if they need to, adding to the debt. The hospitals have changed their charity care policies. If somebody is sick, they should talk to the doctor about what kind of financial assistance is available, because they may qualify for a program that they don't know that they can meet. Just really proud Governor Cooper, Secretary Kinsley, our predecessors, for initiating this program, and grateful to Dr. Sangvi for continuing it with great urgency.
Governor Stein, you were able to hear two testimonies from two ladies that were present at the meeting today. What did it mean to hear firsthand what it means to see someone's debt relief and them be able to tell you about it?
Yeah, one of the women, she's been carrying this debt for about 17 years, she said. It started with a cesarean section. She didn't ask for that. Then she had a gallbladder problem. She didn't ask for that. But she had thousands and thousands and thousands of dollars of debt. And meanwhile, the child who was born is getting ready to go to college, and she wants to pay for that college. So to have the medical debt relieved enables her to have financial assistance to her daughter as she starts her future. And that's what we want, is we want people to thrive and not to be burdened by the debt.
Yeah, most definitely. I mean, I think you hear how real it really is, and I think it's important to also note that these are individuals who are trying to pay their debt down. These are not individuals who are saying, I want to find a way to avoid it. So to go back to one of the stories, to be paying a single debt off for 17 years, it just shows the enormity of what's weighing people down. I love the anvil analogy. When you're carrying that anvil, you can't spend that money on other things. It slows you down in your own economic recovery. So there is a magnifying effect that this is going to have on the people for whom debt is relieved.
Yeah, there was a woman that Deb and I met with before, not here today, and she was carrying this debt, and she had to keep her children out of winter activities. They couldn't do whatever it was, whether it was dance or basketball, because she didn't have the cash. When she got this letter, she was able to say to her kids, you know what, you can do ballet, you can do basketball. We want families to be able to do what their passions are, what their dreams are, and this debt holds people back.
After hearing these testimonies, how do you make sure that this program can continue down the line?
We're going to do everything in our power to do just that. There are a lot of challenges we are going to be faced going forward. Understand that the federal government is cutting Medicaid by $1 trillion over the next decade. This is going to be devastating to healthcare all across North Carolina. And so the waters are definitely choppy, but we are committed, the Secretary and I are committed to doing everything we can to help ensure that people are healthy, that they have access to health care, and that they can afford that health care.
Yeah, most definitely. You know, the important thing here is it's not just relieving debt. We're creating structural redesign in those 99 participating hospitals. So again, thank you to them for participating. By changing those charity care policies, you have an enduring effect on what we're trying to do here.
All right. Thank you,
One more
everybody.
question, please.
Sure.
Please, one more question. Just to
Sure.
switch gears for a little
Yes.
bit. We know that there's a situation going on in Charlotte and Raleigh. Do you know any of specifics about immigration enforcement possibly coming further east? And is there any obligation from sheriffs to cooperate? What's kind of their responsibility?
Yeah, unfortunately, Customs and Border Patrol has not shared with us what their operational plans are. We've asked, we've not gotten responses. What we see are essentially federal forces in paramilitary garb carrying weaponry, masked, rounding people, sweeping them up off the streets. They're going to people's homes where there's landscapers and demanding papers of the landscapers. They're getting people walking on the sidewalk and just grabbing them and sticking them into an unmarked van. This is happening in Charlotte. It's happening in the Triangle. We don't know what the plans are in terms of whether it's going to come further east. But this is not how it's supposed to work. This is not how it works in America. People, when you're walking down the street, people should not come up to you and say, "Where are your papers?" That's not what happens in this country. I want dangerous criminals to be arrested. I want them to be deported if they're not here lawfully. But that is not what is happening. What is happening is they're just sweeping up regular people, and it's a real problem.
Alrighty.
Thank you very much,
Thank
Governor.
you.
Greatly appreciate it.
And again, that was Governor Josh Stein talking not only on medical debt relief, but also there at the end, you saw him give, again, some comments on the Customs and Border Patrol agents conducting ICE raids in both Charlotte as well as Raleigh. Now I want to turn our attention to your weather forecast. Here is a look at what we have seen so far today. Light raindrops continue to pull away from eastern North Carolina. That will leave us with a little bit of sunshine coming in tomorrow, but for the most part, we're looking at cloud cover largely sticking around through the rest of today into tomorrow morning. Now here's a look at the last of the raindrops working their way across the Outer Banks as we speak. Currently in Grifton, skies are clearing and air temperatures are climbing. 72 degrees in Grifton, northerly wind at 10 miles an hour. We've got 76 showing up through really several spots. New Bern, Oriental, as well as Jacksonville. 70 degrees in Goldsboro, as well as Hatteras. 73 in Kenansville. But once you get north, really along Highway 264, you're seeing more of the mid to upper 60s. Now, it's not, we're still above average. Normal this time of year is right around the low 60s. So mid to upper 60s, still feeling pretty comfortable. But we will start to see air temperatures fall from today into tomorrow, and more importantly, we're going to see our humidity fall because of these winds. It'll help bring in a drier air mass, which is why we're largely going to be missing out on another chance of a few drops coming in tomorrow. Now, zooming the picture out a little bit further, here is what we've got across the southeastern United States. That area of high pressure is going to do a great job of keeping us dry. The problem is it's not going to be strong enough to keep us sunny. So moving into your Friday, we will have some morning showers possible as that warm front tries to extend its reach into North Carolina from Virginia. But the bulk of the rain with that system still resides further back towards the west near Mississippi River. And that is going to be moving through eastern North Carolina, more so, we'll call it early Saturday morning into Saturday afternoon. Some areas may see a few drops coming up that late Friday evening, but I think most of the rain, again, is going to hold off until we fully get into your Saturday. And now Sunday, again, looking breezy, but air temperatures will be down by about 10 degrees, 77 on Saturday, 67 by Sunday. And then next Wednesday, we'll have another opportunity for rain. Now, rain chances for Saturday and Wednesday certainly looking more promising for eastern North Carolinians, not only just because the systems themselves look stronger, but also we're looking at higher humidity levels coming up for Saturday as well as next Wednesday. The higher your humidity is, the more rain you can squeeze out of the atmosphere. So good news in that regard. We are in need of the drops. The updated drought monitor will be published coming up for tomorrow. It will be published tomorrow, and we'll have that coming up for you starting tomorrow morning. Most likely at around 10 a.m. is when I believe they actually issue that. Anyways, that's all we have time for today's 2 p.m. News and Weather Update from the First Alert Desk. I want to invite you to join me for a science segment coming up at 2:30. We're going to be discussing the importance of coral reefs and how they are the first tipping point to really get pushed over the threshold in our battle against climate change. I'll have more details on that coming up at 2:30. Until then, I hope you all have a fantastic rest of your Wednesday.